Left, eh? Close? There we go. Gotcha. That's a big one, guys.
Porque está aquí. Vengo por una migraña que tengo. Se me cerró el ojo.
Yes, headaches, migraines, guys. And so she's in really, really bad shape. And how long has it been?
¿Hace cuánto? Hace 2 semanas y 3 días.
3 days.
It's 2 weeks and 3
2 weeks, 2 weeks, 3 days, gotcha. And so, tell us where the pain is. ¿Dónde te duele?
En esta parte de la cabeza.
Gotcha.
Hasta acá.
And on a scale of 1 to 10, how bad is it?
De 1 a 10, ¿qué tan mal está? Un 10 ahorita.
Gotcha. What has she done to treat this so far?
¿Qué es lo que ha hecho para poder quitarse el dolor? Tomar pastillas. ¿Qué más? Sobarme. Take pills, do massage.
She has a kidney. Tell us about the kidneys and the diabetes.
Tengo lo del riñón, diabetes y alta presión.
And what's that? What's the last part?
High blood pressure.
High blood pressure. See how her right eye is closed? Completely closed. How long has your right eye been closed?
¿Hace cuánto tiempo que se le cerró el ojo izquierdo? 2 semanas y 3 días.
Gotcha. And so she's been to the doctor to find out if the eye is a problem. She's also been checked out for stroke, right? We did a whole stroke panel on her. And so a lot of you guys will be like, you better make sure she can get adjusted. I already went through this whole thing. She's had a CAT scan. She had MRIs. And so we checked her heart. Everything's fine. Tell us about dizziness. Mirado.
Sí.
Gotcha. And sleep. How's her sleep?
¿Cómo está para dormir? No duermo bien.
Doesn't sleep at all. And then tell about her constipation.
¿Qué es lo que siente en la panza? She's got a lot of diarrhea. Quiero vomitar y diarrea.
But she has this diarrhea issue that she had really badly, and now it's constipation. She doesn't even think she has constipation, but she only goes twice a week. ¿Cuánto te duele la espalda?
10.
10? Okay. ¿Te duele la espalda?
Sí.
¿Cuánto?
6.
Okay. ¿Te duele? ¿Cuello?
No, solo pierdo el balance.
Yeah, look at her fall, almost fall, guys.
Solo pierdo el balance.
¿Bajo? Okay. Any pain? ¿Te duele?
Me duelen las dos partes de la
¿Cuánto?
Como un 7.
7. Big imbalance here. 29 millimeter right imbalance, 14 degree scoliosis, and you can see the occiput tilt. Here we have 7 degree curve and constipation. Here we have 103 forward millimeter head carriage and 1/3 atlas wear. And the last one we have arthritis and sway back and constipation. She had her first atlas adjustment the other day, and I don't know if I even recorded it. Did I record? I did record it, yes. And so this is 4 days later. And so tell us how things have changed over the last 4 days.
Dígale cómo ha cambiado las cosas durante los últimos 4 días. Pues se me ha quitado más el dolor de cabeza. Less headache. Y ¿cómo se dice? He podido más abrir un poquito más el ojo. She could open her eye a little bit more.
Gotcha.
Y antes me dolía mucho la espalda y ya no me duele. No back pain, no headache.
And tell us about the dialysis too.
¿Y del diálisis? Del diálisis, sí, pues algo con dolor de cabeza, pero es el mismo que me llega de aquí del ojo, toda esta parte.
What'd you say?
¿Pero ha sido menos? Menos. So she said she still comes out with a headache, but it's less than before.
So we taught her how to lay in the recliner, and we taught her about how to relax. But the biggest thing is that she says it's better, but she was taking drugs when she's sitting there. They give her drugs to sit in that chair for 4 hours because her cabeza hurts so much. And so she said no medication all week, was able to sit there at only a 4 out of 10 pain laying, and that's the best. She was 10 out of 10 before.
Yeah.
10 before dollar at dialysis before. Remember that? And so she's down to a 4, and that doesn't seem like a lot of improvement, 60%, but no medication now either.
Yeah.
So anyways, we're happy for that. So that was an atlas adjustment, and then her eye is starting to open. So let's get a little closer. Good. Now, open your eye as much as you can. Look, so you can see her opening now, and that is like 1,000% better. she can actually open it, right?
Yes, and at times you can leave it open.
At times you can leave it open now. So that was all since the Atlas adjustment. So you guys don't think this stuff can work, but you can see the beginning video, how she couldn't even open it at all. Now she can open it, okay? So we're gonna go right back and do the Atlas again. Did you guys hear that? That was loud.
Mi cabeza.
Felt it right in the cabeza, yeah. That was so much better. So much better. Wow. So much better than Lunas. But now she has to learn how to lift, use more muscle. Okay. Okay, try to open your eye. Wow. Look at the power. Good. Good. I love it. Ask her about her pain, her headaches now.
¿Cómo está el dolor de cabeza ahora? Ahora ya no tengo headache.
But her eye's been closed like this for months. Okay, so, but open your eyes now. See, look at how far they're opening now. Okay, and now with it open, we're also seeing that she's having trouble tracking her eyeball. So open your eyes and derecha and izquierda. Look to the right, derecha. Now see her eyeball roll to the right, and see this one roll to the right over here. Now open again. Oh, now left, izquierda. See, this one goes to the left, this one doesn't. So this medial muscle over here, this nerve that goes right here is not working. And so she can't do it. So we send her home with exercises. She's doing 20 back and forth, left and right eye motions a day, 3 times a day. And we're going to adjust her again and see if we can get that turned on, which I have every confidence that's going to turn on. It's all turning on every week that goes by, every day that goes by, she's opening. Tell us the funny story about the earthquake.
She felt the earthquake and both of her eyes just opened wide. Both at the same time.
But I'm really happy with her progress. We get right there in the Atlas. Very important to get the Atlas. This is the one that's tugging on it. Excellent. Wow. Did you guys hear that? Woo-wee! Wow, that went a lot. You heard that too. I think that was the best Atlas adjustment I've had on you. Absolutely the best. ¿Mucho te duele?
¿Le duele mucho más?
No. No? Checking out Virginia and her daughter walking around the building to obviously recalibrate. Okay, so we're here with Virginia and she's getting better. I think she's getting a lot better. We did the occiput adjustment and I think it's really made a difference. Look at her eyeballs. She doesn't even close her right eye anymore. I mean, it's closed, not as good as this one, but it was shut in the beginning. We'll do the comparison. You guys will see that in a second. But the other thing too is we talked about how her eyeball was not going left. It was only going right. And so we're going to have her show you guys how much better it is. Come a little closer. Good. And so let's do this. Good. Now look straight ahead, open, and then derecha and izquierda. Good. Izquierda. Other way. Izquierda. Good. You can see it almost goes all the way over, and that wasn't happening before. No. Again, occiput adjustment. This is not a lift. This is not a yank. This is a set. We're setting the bone down on her condyles of her atlas. And why is that important? Because if you lift it, all you're doing is you're changing you're gapping the joint. You're creating movement in it, but you're not putting it where it needs to be. So that's the problem with all that yanking of next guys out there and people who do these occipital lifts. It's not putting it where it needs to be. We're actually putting it back where it needs to be. Watch. Yeah, so she says she likes it, but she doesn't. She's getting a lot better. I am at a quandary of what to do with her because I know it's still neurologic, and we've adjusted her occiput or atlas in the past, and her eye is improving. You can see it. I don't know if you can see it, but both eyes are open. But she has a little bit of a lazy eye now to the right. It's still the right ciliary muscle is stronger than the left. Now she can move her eye left, but she doesn't have total control all the time. So I worked on her jaw last week, and her jaw is sore this week. I still think part of it is the jaw, but because it's so neurologic, I'm going to go back to the atlas, which I haven't done in months. And so we're going to do that right now and see what happens right now. I asked about trauma in the past, and I don't see any reason for trauma. She did have a family member pass away when this all started. So there's definitely an emotional component to this, but the neurologic component is definitely structural somehow, and it's not letting go. I think we're about 60% there, but the last 40% is kind of tough to get rid of. Her headaches are much more manageable, but again, this last neurological push is going to be either a cranial issue or a function of how to relax her atlas. So anyways, still figuring it out with her. That's her atlas. And again, I've done this before. I didn't seem to have much help. The occiput was way better. But now that we've moved the occiput for a while, you guys heard that, right? The whole world heard that one. Woo-wee! How painful was that?
Me dolió donde me apachurró y sentí que me temblaba hasta esta pierna.
She felt it in her leg, huh?
Yeah.
Okay. Left atlas on this side too. Okay, so I was going to save this for next week, guys, but we're going to do her clavicles this time, and I'm thinking that maybe some of this. See how painful her face is? I don't know if you can see her face, but she don't like this at all. Maybe I start with the other side first. And so I do this when I have a lot of patients who don't respond very well to the atlas adjustment or the neck adjustment. So the clavicle is a foundation for all the muscles that go into her neck right here. So we're going to try to adjust it a little bit, see what happens. And so we're not going to go really hard. It's down here. Yep, she ain't gonna like it here. Good. Okay, respira. Exhala. Good. Ooh. See here, she loves that one. Okay. And again, by adjusting this clavicle, I've seen patients do tons better because it relaxes all the neck muscles. There we go. You guys heard that one? Good.
Ay, me duele más este lado.
Yeah, it still hurts on the right. Yeah. But there's a ton of pressure in there, and the reason I wanted to release it again is I want to have a chance for her neck to relax. So we'll see how she does in that one. Okay, so we just worked on her clavicle, and her back instantly felt better. So we know we're on the right path to a certain extent, except her eye. Go ahead and look up with your eyes. Look up. And that still hurts up here, still a 2. And so we haven't affected that yet. So I'm going to try one more thing here, and we'll see if we can get it to go down a little more. Like I said, the path we're taking is all on the right path. It's just a matter of getting it to find the exact thing that works on her, and that's the hardest part here. This is her SCM, guys, and this is the muscle that's connected to her atlas, which is connected to her clavicle, which I just adjusted. And so I'm going to see if this takes some pressure off her eyeball. Good. Tremendous tension in her occiput. Still, even after the adjustment, tremendous tension.
Cuando respire por la nariz, lo deje salir por la boca, pero no con esfuerzo, sino que solito se salga.
Yeah, like that. Okay.
Así.
Yeah. Okay. Respira. Exhala. Good. So this is our first thoracic adjustment, guys. And the reason I'm doing this is a 14-degree scoliosis upper back. I've adjusted every part of her neck, and so there's something still missing. Her eye is, I would say, Jesus, 80% back, but there's still some stuff going on there. So we're going to see if this is the last little bit of foundational work that'll help balance out her neck. Okay, exhale. Good. ¿Te duele?
Poquito.
Poquito? Okay. Uno más. Good. Wow. Perfect. Okay, boca arriba. You okay? Painful? Yeah. So I did Atlas last time. I thought it went really good, and so I did occiput again this time, and you can see her reaction that it was a little sensitive. And so why is that? Well, because it sounds like I needed to do it again. We didn't do it enough last time. Okay, I'm going to set up on her mandible here. I need a little set here. Abre la boca. There you go. Relájate. Good. Yeah, okay, that's it. You can see how much pain with that was. But look at her eyes, guys. See how her eyes are open? And I've shown you videos before of her eyes closed. And now look up. Look up. Arriba. And so she still has pain in this, when she does this. It's a 5 out of 10 pain. And we're always able to bring it down. So tell her where her pain is. Ask her where her pain is right now.
El dolor está acá.
Yeah. And so she's tons better. I mean, if we stop treatment today, she'd be a really happy camper. But we still are having trouble finding out where her exact problem is. And I've adjusted her occiput, I've adjusted her atlas, I've adjusted every part of her neck, I've adjusted her shoulders, which everything helps. The shoulders actually help a lot. But for some reason, we're still missing something. So we're going to try something different today, and I'm going to do her jaw.
Lista.
Scared? Look at she's scared. You know, the funny thing is I've adjusted her so many different ways, and she's scared of this one. She doesn't even know what I'm doing yet. Okay, so we're going to do this because we've had trouble with her. Again, so many things will work on her, but it's just not lasting. So I'm going to try this adjustment, which I have done on another patient. That really was a game changer. So we're going to give it a try on her. I even adjusted her TMJ already. So, but this is a different one. Okay, so open your mouth. Good. And don't close. Keep it open right now. Ask her how much pain that is up there.
Nada más de este lado me duele.
What?
¿Cuánto?
More up here? Gotcha.
Como un...
Okay, open. Abre la boca. Good. Good. Okay. Where do you feel that? Up here?
Sí.
Gotcha. Good. Okay, open a minute. Abre. Good. Now close slowly. Close. Close. Slow. There we go.
Oh, she bit her.
Oh. She bit her tongue?
Yeah.
Oh. You okay?
Está bien.
The tongue got bit, right?
Yeah.
But how does this feel up here?
¿Cómo se siente?
Different?
Menos dolor.
Diferente. Good. Now, okay.
Siento como que lo hago.
Yeah, it feels like it's up. Good, perfect. Now, look up too.
Mire para arriba. Los ojos nada más.
How's it go?
¿Cómo está el dolor de cabeza?
2, 3, 4, 3. So it came down. So see, guys, when everybody thinks that the neck is always the issue, sometimes it can be the TMJ, because the TMJ affects the neck. Okay, so we're going to still adjust her, but I wanted to get that adjustment and let you guys watch. I'm going to adjust her shoulders here too. Okay. Relájate.
You want me to take it off?
That's fine, I think I can get it. Good. Okay. Relájate. Good. Okay. I'm going to adjust her lower neck. I usually do atlas and mid neck, but we've been having good success with her lower neck adjustment and these shoulder adjustments. So I'm going to try to repeat that down here. I haven't done it down here for a while. I've been doing it in the chair. So again, I'm adjusting C7, guys. Really low on her because, again, she has some kind of issue with her clavicle, her shoulder, and her lower neck. Drop, relájate. So ask her about her jaw again, how it feels different.
¿Cómo se siente su mandíbula? Mejor. Sí está todavía como hinchado, pero ya es... Less pain.
Less pain? But open your mouth, open and close. And she says, And so what is that? How does that feel different?
¿Cómo se siente eso diferente? Bien.
Yeah. So again, so you guys saw the adjustment a second ago. I just want to show you the results. Okay, good. Okay, guys, we're going to adjust her low back, and she's in pain right now a little bit down here. We have not done that before. You're going to breathe in your nose, nariz. Breathe in. Respira.
Respira por la nariz.
Exhala a boca. Abre la boca. Okay, respira. So we're going to just do a prone L5. Did you guys hear that? Woo, baby. Merry Christmas. I'm working her pretty good today. Open the mouth. Abre la boca. Mas. Good. Close. Okay. Mucho te duele? Okay. Okay, open please. Okay, relax. Close. There we go. Gotcha. That's a big one, guys. Big one. Okay. Good. Okay, that's total. Respira, nariz. There you go. Okay. Uno más. Okay. She's not relaxing this time.